push the button. There you go. So if you'd like to turn off your cameras or adjust your screen name, you may do so now. And then we're being recorded, and that's we've started that. So that is great. So I'm now going to turn things over to our moderator for today, and that is Shawn Jones. Shawn is joining us from Calgary. She's a issues strategist with the City of Calgary and supports the Calgary Age Friendly Initiative and is a member of the Alberta Age Friendly Community of Practice. So over to you, Shawn.
Thanks, Carol. Good morning, everyone. I'm delighted to be able to moderate the first in this housing series with the Alberta Age Friendly Community of Practice. And so I'm going to give you a little run through of some of the age-friendly pieces before I hand over to the speakers. So Alberta Age Friendly actually has two groups on Core Alberta. One is our Community of Practice, which I'm a member of, and it's really designed to help communities that are considering or in the process of developing an age-friendly plan. And it's a closed group of members who meet regularly and offer support to each other in a mentoring capacity. And there's also an age-friendly discussion group that's open to anyone who's interested in the age-friendly concept or its 8 domains. And the focus of this group is really about disseminating information and providing opportunities to ask questions and share information. Members may or may not be involved in an age-friendly initiative. So if you're interested in learning more about age-friendly in these two groups, I encourage you to visit the Core Alberta site, and you'll find them in the groups tab on that page. Okay, so what is age-friendly? So we just wanted to explain a little bit about the concept behind our group and where it sort of comes from. So age-friendly is a model to enable active, healthy aging by focusing on 8 domains of community living. Age-friendly communities really help older adults or seniors remain engaged in their communities through the development of supportive, built and social environments that facilitate exercise, social connection and respect for seniors. And you can see the World Health Organization's 8 domains there on the left-hand side. And really the journey to becoming age-friendly employs a bottom-up participatory approach that involves the active participation of citizens of varying ages and abilities in all aspects of planning. And the cornerstone of an age-friendly model is the development of a community plan, which brings together traditional and non-traditional partners to identify community assets and strengths that facilitate social inclusion of seniors and factors that hinder it. Each age-friendly plan it's fairly unique as it addresses that community specific needs. So implementation can be achieved through small steps initiated by local community members or through more major initiatives that require greater resources and contributions from a broad group of people or the collaborative efforts of a range of groups. So specifically thinking about that housing domain, there's a checklist of essential features of age-friendly cities that the World Health Organization puts out. And it really reflects kind of those critical issues. So according to the WHO, the housing conditions of older people are often linked to their quality of life and where they're able to age independently and actively in their communities. Appropriate housing designs and its proximity to community and social services allow older residents to live comfortably and safely, while housing affordability gives them peace of mind. For this 5-part series, the the Alberta Age Friendly Community of Practice will explore the range of seniors housing from homelessness to continuing care. And the goals for this series are to help foster a shared understanding of the housing needs of seniors, identify enablers to support seniors to live independently, encourage and facilitate a variety of age-friendly housing options for senior. As the first in the series, the session will set the stage by looking at why this topic is important, where Alberta seniors live and their housing preferences, and information will also be shared on how the Alberta Affordable Housing Strategy supports housing for low-income seniors. And then we'll obviously move to questions and answers. Okay, so just to sort of set the stage here, and give you an overview of the scenario for older adults in Alberta. Most seniors really want to remain in their homes for as long as possible. According to the 2016 Statistics Canada census, the majority of Alberta seniors, so it's about approximately 90%, live in private dwellings. Private dwellings include movable homes, which is about 3%, apartment buildings, over 15%, and houses, which is almost 72%. The approximately 86% of seniors in Alberta in private dwellings are homeowners, and while about 1 out of every 7 Alberta seniors in private dwelling is a renter. Close to 24% of Alberta seniors in private dwellings actually live alone. And seniors are less likely to move than the general population. Generally, those housing moves by seniors can be characterized as either lifestyle, planned, or crisis, each of which is typically underpinned by a number of push. So that might be the death of a spouse, for example, or pull factors, which might be desire to be closer to children and grandchildren. So the seniors population is multifaceted and has diverse living arrangements and housing needs. And as individuals age, their needs and capabilities can change, and they may experience challenges in finding suitable housing to accommodate their changing needs and services. That's one of the main reasons why the Alberta Age-Friendly Community of Practice is exploring this topic and sharing information to support the housing needs of older Albertans. The population aged 65 and older is expected to increase both in number and in population. So in 2020, almost 611,000 Albertans were aged 65 or older, which accounted for about 14% of the population. And the number of seniors is expected to top 1 million by 2035 and to exceed 1.2 million by 2046, which is essentially a doubling of the population, making it kind of 1 in 5. And life expectancy is also expected to increase. So a man aged 65 in 2020 could expect to live on average another 19.5 years, so making them 84.5. And a woman would be expected to live another 22.3 years, making the average life expectancy 87.3. But in 2046, average life expectancy at 65 is expected to increase to 21.7 years for men, so to 86.7, and 24.3 years for women, so that's an average life expectancy of 89.3. It's quite a significant increase. And then in addition to that, there's actually going to be rapid growth in the oldest of older people. So in assessing demand for services such as healthcare, assisted living, and seniors housing, it's especially important to look at the population aged 80 years and older. This age group is expected to more than double as a share of the population. So it'll be increasing from 3% in 2020 to almost 7% in 2046. And this trend represents an absolute increase of about 301,000 people who would be 80 years and older, and that's an over 200% increase as a percentage. Okay. And then I'd like to hand over to our first presenter, who's going to share what she has heard from seniors concerning where they live and want to live in the future, gaps and challenges seniors are facing with regarding to finding appropriate housing, and how the Calgary Seniors Forum helps seniors to find information to make important housing decisions. So Kathy, I'll hand it over to you.
Thank you. Thanks, Shawn. So that really set the stage nicely for us. So throughout my career, Carol actually is going to be my slide changer. So Carol, maybe let's go to the next slide. So here we are. I'm actually a volunteer president of the Calgary Seniors Housing Forum Society today, and I'm going to be sharing with you our findings as a society. I also do consulting, which I think also I've heard a lot of feedback from older adults just about the physical plant and how that meets their needs. And then working with developers and trying to find out what they're trying to achieve. And then Also, I think it's important to understand that I actually started my career in the front line. I'm a recreation therapist and have been in the industry for about 30 years, but I did start out in community living, which also I think gives me an interesting lens. And then lastly, I am currently with Silvera for Seniors, which is located in Calgary, and our communities offer a variety of housing choices for older adults, which include percentage below market, rent geared to income, and near market, mixed market, and then actually full market rate. So away we go then. The Calgary Seniors Housing Forum Society, our mission is to provide relevant information to older adults. And we do that through a variety of ways. We can only do this through the support of some sponsors. And those sponsors enable us to do a variety of housing forums. They allow us to hold webinars and a variety of other strategies. Thanks, Carol. Here you can see a picture since 2003. We actually have quite a following of older adults. We have a distribution list of almost 200 older adults that follow us. And when we have the opportunity, BC before COVID, we would gather people and we would have a variety of speakers. So we always tried to have somebody who was health focused. We'd have a representative from the government come and speak to us. And then following, we would have a trade show of housing providers. The way that we reach people is that every 60 days, we actually purchase space in the Calgary Herald, and we put topics in there and invite and share older adults to tell us what they think about that. We also have a website, Facebook page, and a distribution list. We have interactive panels in which we actually invite older adults to come and speak as well. Carol, you're doing great. Excuse me, please. So we have a variety of full spectrum in Alberta, and I will say we're very blessed. So today I'm going to speak primarily just about the feedback that I get on housing types 1, 2, and 3, which you'll learn about. The long-term care and supportive living, the feedback that I could give, that's a presentation all in its own. So we'll just go. Housing is such a unique journey though. And I think before I even start talking, I really want us to understand that barriers and strategies are unique to the type of housing that we're discussing. And that not everybody actually should stay home, and that some people are actually not suited to community living and other people are well suited to community living. So part of our strategy, I guess, going forward is really understanding individuals and what might be best for them. By doing that, we may have to then look at models that support people in a choice, thinking about respite, thinking of short-term stays, thinking of variable models in which we can support older adults achieving their housing and lifestyle goals. So the ownership model on the left-hand side, they actually, what I have come to learn, have many, many choices. And they do bring forward to us about the traditional housing model, how they'd like to see co-housing, shared accommodation, laneway housing, mobile homes, and intergenerational. There are many community supports that are currently in place and are very successful. It's on the right-hand side that I just want to bring forward, and I hear a lot from this group of people. People who are renting, I think we think that those individuals would be in a nice little apartment somewhere, but many times what we are hearing is that they're in a basement suite that may or may not be legal, that they're in a shared accommodation setting and it's not always ideal. They have an apartment or townhouse that they very much enjoy, but they need different supports. Many individuals that we see are actually couch surfing. So they literally do not have a home to call their own. They're living in a motel because their rental accommodation came to an end and they were unable to carry on, or they're in boarding houses. So they're living with many, many other people and are just actually renting a room. What comes along with that, and we'll talk about that in the slides ahead, is there's transportation issues. They're not able to modify their home because they're not the owner. Housing stability and rental is variable, and the actual housing quality. Sadly, we hear a lot about mold and proper ventilation. So what we have heard from older adults is that they would like to stay home. Thank you, Shawn. But they would like to be connected with others. Being connected makes all the difference. So staying in their home and then inviting virtual supports into those surroundings. I have some of them listed here. So if they were connected by a network using a telephone, and I'll tell you more about that, they'd like to be able to ask questions of one particular person. What should I do about this problem? Or I would like to hire somebody, but they would really like someone to help coordinate that. They're afraid to let a contractor into their home because they've heard so many bad stories about contractors coming and stealing all their money. So they'd like to have almost a senior approved list, which I know sounds a little Pollyanna, but they really would appreciate that past what perhaps the Better Business Bureau could offer. A transportation pool where they might be able to drive each other, or leisure buddies that they would be able to tag along with and easily connect with. They would like to be able to talk to people about minor home maintenance issues, and that perhaps there's, hire a husband for seniors, and rental programs for technology, so that maybe this group of people will make it up. There might be 40 people. They could actually share an iPad or share technology so they don't have to enter into an ownership model. I think our real elephant in the room, though, is computers. I hear this constantly from our community living coordinators at Silvera, working with individuals looking for housing. They don't have computers. Going back to the rental model, couch surfers, motel people, people who don't have stable housing, they are not hauling their computer with them. And they actually are not technologically savvy because of their financial situation. The barriers in technology, it changes so fast, I can't even keep up. I most of the time am faking knowing what's going on. And by the time they get technology, they need to consistently be learning. So what they're hoping for and give us feedback about is they'd like to have support about technology, troubleshooting for older adults. Also, this is the wild part, is that they need to be able to print documents off. Printers are not all that expensive, but the ink is. So this is a major barrier. And English literacy in learning. The non-traditional housing, looking at that, there are many people, just as Shawn said, own their own homes, but they're not able to do anything with it to leverage that asset. Barb will probably talk about that later on, but they're really interested, or their families are, in having a little granny flat in the backyard, being able to put that in. They're wondering about the home care model. They'd rather hire their own company so that they have stability on who is coming and might have the language skills that better suit them. They'd like to be able to rent out a room in their house, but fear that the person might not be appropriate. They'd like to potentially share accommodation with another senior, but they don't know. It's sort of like a dating app for seniors, but for housing. They need some type of support for that to make sure that people are vetted out correctly. Home modification programs, honestly, you need to go to Yale to figure that out, and you need to have technology. So this is very difficult on them. And then also many of our older adults, specifically, I can only speak to Calgary, they live in older neighborhoods. And so their taxation, sometimes they're in the downtown core. I see Barb's nodding. Taxes are going up, 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 up. And then these older homes, their utility costs and the complexity of their programs, people ringing their doorbell. Don't you want to be with ABC? CDEF is better. And they end up just closing the door and closing the drapes and hope for the best. Thanks, Carol. So also, I guess we're talking about advocacy. Well, we're hoping that people would be able to support them. We always think, well, let's look at those natural supports. Well, unfortunately, family and friends don't always have our older adults' best interests at hand. So we often hear from them that they wish that there was some way that they could call an easy number, not 311, 811, none of the one ones. They just want to call a number and say, I need some help finding some housing. So we have the Kirby Center and we do have a variety of other supports. Strangely, everybody doesn't quite know about those supports, but they would like to say, you know what, my daughter thinks I should move and I don't feel good about that. Is there someone who could help me? The next point is, when selling their house, we find out that perhaps there's little fingers in the money pot and they don't know who to call because they actually might not have the most wholesome relationship with that family member. So they wouldn't mind having someone come in as an advocate to help them sell that. Wills are very expensive. And so oftentimes wills are drawn up by other people and they're told sign here. So if there was someone who could help them, access to lawyers, guardians, power of attorney, we often see in Calgary Seniors Housing Forum, we have a realtor who actually works with older adults, and it's surprising how many people have signed away their assets, not understanding what that means. Also, people are wondering, can we have our own space? So within the city, we have many different congregate settings, but people very much enjoy having their own fresh air, privacy issues, especially during COVID. They'd like to have a community hub, so a variety of little homes. We currently at Silvera, now referring to where I work, we have a 2-year waiting list for fully independent living because it's very popular. Rent geared to income settings are highly sought after, but especially these little houses. So why not let's think about modular homes, mobile homes, all these little garden homes, instead of always the big buildings. What's really popular is little and all mine. Pharmacy, nobody ever talks about this, but I'm going to. So pharmacy is a funny thing. We have people who end up in emergency, Barb smiling. So they're doing great in their own home by themselves, like Shawn talked about, but actually through episodes and not understanding literacy and health literacy, they actually are not taking their medications correctly. Autofill, the pills keep coming, even though they're not taking them, which is a drain on the province's resources and also financial resources of the actual person. People are discharged from hospital, they go home and they can't remember what they're supposed to be doing. So there's lots of thoughts around geriatric support when people are at home, access to a physician. The discount approach to medication. So basically the big box store, you drive through, someone slams a bag in your hand and away you go. They've explained to you what you're supposed to do, but they're not quite sure. Guess what happens? Low compliancy, high needs on the healthcare system. There are places in the world where they do have pharmacists that do home visits for older adults and people who are registered. Brown bag events in congregate settings where people bring their medication in a bag and it's reviewed. So I have been exposed to a brown bag event in Calgary, and we found out due to language barriers, a husband and wife for the last year have been taking each other's medication. They actually were illiterate. So we were able to help them with some great injury, and they were actually in very good shape following. Thanks. Carol, away we go. So people just in general are overconfident that older adults are going to be able to follow those instructions, go home and understand medication complexities, the side effects, mixing medications with what the lady said next door. We hear a lot about this, a lot about how people feel isolated around their health and the medications that they're taking. Thanks. Next slide. Also, cable TV, little things like this, people move in to a new setting, and this is just really lighthearted, but who can understand it? we'll just go ahead, Carol, thanks. So they aren't able to get the right package for themselves. They spend a lot of money, and it's because they just don't understand. They've got this giant package of cable. It's costing them a fortune, and they barely can turn on the controller. Next slide, please. Utilities are very high. And so it has been suggested that for that older adult that we might have modified rates. So if we think about the life expectancy being around 84, hey, why don't we help the people who are in their high 80s stay at home as long as possible by giving them a break? It would be timed out, so perhaps they just need a reprieve for a couple of years while they get a game plan together. But upgrading windows, doors, and eco-furnace just isn't going to help the same way this is going to. And going back to my other comments, they find that overwhelming. Next slide. So let's just talk about some of the varied settings. I am determined to stay on time, Shawn. So away we go. So what we hear is there's lots of different settings, but within these settings, so congregate, lots of people in one building, townhouses, apartments, and even active adult communities, there's some trouble. So rent geared to income is a wonderful program. And we also have the percentage below, 20% below exists in Calgary, 11% below. Let's talk about rent geared to income specifically. Since I only have 25 minutes, I'll focus on that. Next slide, Carol. Here we go. So they have to establish their income. Those applicants, here's the trouble. They don't always have a social worker alongside of them to facilitate, who, by the way, are amazing if you have a social worker. But if you don't, sometimes the applicants have to establish what their income is off line 15,000. I may have even missed a zero on my little flower petal. So they have to get on the phone to Service Canada or to Revenue Canada. So you could paint your house, mow your lawn, and actually detail your car before your turn comes. So that's actually a problem. Also for discharge planners, transition services who are trying to help, they themselves could actually sweep the entire Foothills Hospital before their time is up to establish what someone's income is to help them. Don't have a computer, so they can't do it online. They may not even have done any income tax, so we get to see their bank account, and we have to scroll through to see what income they have. They might not have a steady income. They don't have a bank account. They don't have a steady address, so they can bring in things, so they have to go to the bank. You get the picture. So we end up really hoping to help people ourselves as housing providers. Health assessment. We have to make sure that it's the right fit for the right person in the right location, but many don't have a doctor. The doctors charge for the health assessment. They have to find a doctor that will take them, and then they have to get an appointment to get there. So we're on mountain number 2 now. Next slide. I hope I'm not depressing you. I'm sorry. So then if you've done 1 and 2, you can actually go and see the property, which is fantastic. So they take a bus, get a friend to drive them. Sometimes social workers are there present to help them. They might like the setting, but now we have to talk about moving costs or even getting furniture. And I don't know if you've seen the cost of beds lately, but they're very expensive. Family supports aren't always there to help people, transportation challenges, and then people might have pets. Next slide, please. Now you've done 1, 2, 3, 4, but we priority rate people. So those who have the most urgent healthcare needs or housing needs, I should say, they go to the top of the list. So if you're sort of doing well and are well housed, your chance to get housing is impacted by the rating score. Next, please. The location doesn't always suit people just in general because they have natural social supports. They want to be near their doctor, or they don't have a car. So the building has to be near grocery store. So after all of this, they may then decline because of the location. Next slide, please. Couples, of course, are always difficult to house because of the inventory is low and their incomes get also assessed. As a couple, So if one person passes away and leaves one person, now we have a different income and we get to start this wedding wheel all over again in many cases. Next slide. Age. So it is older adult housing, but one of the things that is a challenge is sometimes people present much older than their age at 65 and so forth. So overall, I'll just revamp what we were talking about. Transportation, the room size is often inadequate for a couple. The location, rules and regulations, they tell us they don't want to move into congregate setting because they find it patronizing, all the rules. They need access to advocacy, social workers while on site. Many independent living buildings have nobody. Next. Cost of the internet, cell phone, queuing and redirection supports, no air conditioning is a big one, and no pets. So away we go into the home stretch. More than anything, people are just saying they'd rather struggle along because they don't want meal times that are set. They're not allowed to have wine or beer with their meals. Say if they're in a dining situation, it's not always appropriate for different ethnic populations. Some of the independent living buildings have nobody on site to do recreation programs, leisure and arts. Specialized diets in congregate settings are difficult to accommodate, especially if you need low salt or there's high fat and you can't take that. They can't eat processed foods for a variety of reasons, or you're a vegetarian. Next slide, please. There are models that are in existence, are having difficulty getting off the ground. There is the Elder House in Inglewood, which actually can take up just a regular city lot, in which there are little townhouses that face into a common area. This is a very popular concept with older adults. They are alone, but together. Next slide, please. So I thank you very much, and I do apologize that I did canter along, but I did promise Shawn and all the organizers that I would stay on track. So please just accept my little nuggets of gold, and they are just thought-provoking feedback that everybody has shared with me over the last 10 or so years at Calgary Seniors Housing Forum Society. Thank you.
Thanks, Kathy. That was a great overview and a number of perspectives from older adults across the housing spectrum. If people have questions, please put them into the chat or hang on to them to our question and answer session. And now I'd like to introduce our next presenters from Senior Living Housing, who will be speaking to the Government of Alberta role in providing affordable housing options for seniors with low income and how seniors are included in Alberta's recent 10-year strategy to improve and expand affordable housing. So Barb Panich is the Director of Housing Policy within the Housing Division of Alberta Seniors and Housing and has over 30 years of experience working with the provincially supported housing programs. And Sylvia Lepkick, she'll tell me if I'm wrong, is the Executive Director of Policy Planning and Analytics. And over the last 2 years, she has worked on the development of Stronger Foundation, the strategy for affordable housing in Alberta, which was released in November 2021. And throughout her career, Sylvia has worked in strategy and policy across various ministries, including Executive Council, Human Services, and Employment and Immigration. So I'll hand it over to Barb and Sylvia. Thank you.
Thank you, Shawn. Good morning, everyone. I'm very happy to be here today to help kick off CORE's age-friendly housing series. I hope to set the stage by explaining the housing spectrum, which will be expanded on in future presentations. I'll explain what we do within the Ministry of Seniors and Housing and our housing division, and give an overview of our housing programs, which Kathy's kind of giving you some hints coming forward. So with no further ado, I'll jump right into it. So the housing spectrum covers quite a range based on people's different needs. Fortunately, about 83% of Albertans fall in the last two circles on this diagram, which are market rental and market home ownerships. However, that means that about 17% of households fall within the other 6 types of housing needs, which starts with homelessness, which is a challenge for many Albertans. and emergency shelters are not a long-term solution. We know that most people in these situations need supports in addition to a roof over their heads. So transitional housing is intended for stays for up to 90 days, while the household secures longer-term accommodations. Transitional housing may also be someplace someone stays for treatment to deal with addictions, or maybe it's a step after incarceration. While in transitional housing, the household may apply for community housing or affordable housing. Those are types of programs that we administer. Community housing it may be owned by the province through the Alberta Social Housing Corporation, and rent is based on income. It can be as low as $120 depending on your household size and income. Affordable housing costs a bit more, but is required to be less than market rent. And I'll tell you more about that in a moment. In a few cases, a family may access affordable home ownership. And you may have heard of programs like this, such as Habitat for Humanity. Households can move back and forth through these various stages, depending on their circumstances. Now, most of these housing types are generally not supportive housing, meaning in most cases, support services are not provided. However, as we age, we may wish to or need to move to a location that provides supports, such as meals or health care services. Next slide, please. So now let me talk to you a little bit about supportive living and continuing care. So in many cases, a household may receive home care and community care in one of the previous housing types. As Kathy was saying, seniors want to stay home as long as possible, and home care is a way to do that, where you can get services provided in your own home up to a certain extent. The next level is called supportive living accommodations. Now, this would be the congregate settings that Kathy also spoke of, and where you would move into a facility that provides services such as meals and housekeeping. This is something that maybe a senior household decides that I don't want to maintain my house anymore. I don't want to, shovel. I don't want to mow my lawn. I'm tired of cooking. Let's just move into this nice senior's place and have all that looked after. So some don't mind doing that. You also have recreation and socialization. So, and I'll talk a little bit more about it as well coming up, but that is an option. And that is a voluntary choice that a senior household may make. Unfortunately, for some, if their healthcare needs get to the point where you cannot be provided for through home care, you may be assessed for requiring a continuing care home. And those are various levels. Those include just designated supportive living and long-term care, depending on the type of healthcare issues that the family member may be having. And this is where Alberta Health Services would designate and ask you to move into one of these places so that you can have the healthcare services provided to you. And then there's palliative end-of-life care as well, where it is probably a short-term stay, unfortunately, provides symptom management, comfort for the family, the caregiver, and the person at their end of life, such as a hospice, sometimes in a home setting or a hospital. Next slide. So where does the province come in? Well, the province, people like me and Sylvia, we come in when it's non-market housing. And a lot of that is the supportive housing. And there are various ministries involved in this. So if you look at the first column in emergency shelters, both Children's Services and Community and Social Services provide support to those organizations and funding. Community and Social Services continues on through the transitional accommodations and some long-term supportive housing, where in long-term supportive housing, community and social service would be involved, would be the types of facilities that require people who need mental health supports, maybe assistance with addictions or their chronic homelessness. Alberta Health is involved in long-term supportive housing, and that was kind of what we just talked about, the designated supportive living and long-term care. So they're very involved in that. And then our ministry, Seniors in Housing, is involved in those last three, which is long-term supportive housing, like our lodges, subsidized housing, like community housing, senior self-contained, rent geared to income that Kathy talked about, and near market housing. And I'll talk a little bit more about those in some of our future slides. So what is affordable housing, you may ask? Everybody asks that. And there's various answers for it as well. But typically, housing is considered affordable when a household can spend 30% or less of its pre-tax income on shelter. And that's where 83% of us can manage that. If you can't, then you are considered to be in core housing need if it would take more than 30% of your income to find adequate and suitable housing. So we get a survey from CMHC that helps us with identify the housing income limits, and we might call that HILS coming up, which represents the household's income that is required to afford the average market rent. So here's some examples. This is from October 2020, could do for an update, but here are some examples of average market rents by the seven major, the largest 7 communities in Alberta, and then an average for some of the smaller ones. But as you can see, it ranges. Of course, Wood Buffalo up in Fort McMurray is going to have the highest rental costs, not as high as what it used to be. It has come down a lot. And the most affordable would be here down in Medicine Hat, would be less expensive. So next slide. So this would show you, the next slide, is what your annual income would need to be in order to afford that average market rent. So we use those two to say, if you are, I'll just use the top number for ease, if you're living in Wood Buffalo and you're looking to rent a bachelor apartment, if you make less than $40,000 a year, you're going to have a difficulty paying your rent and not paying more than 30% of your income. And that's kind of where we come in. Next slide. So here, this shows that out of the 1.5 million households in Alberta, about 1.25 million of them are able to accomplish or afford market housing with their current income. So we're not in a terrible spot, but that does leave 250,000 households who cannot. And as you can see from this, the province, through our programs that I'll talk a little bit more about coming up, are helping about 57,000 of those households through our various rent geared to income and supportive programs. We've got about 24,000 on the wait list, and then there's another 170,000 households that are out there who are deemed in core housing need because they are paying more than their income, more than 30% of their income on housing. Next slide. Who lives in this affordable housing? Let me give you some stats on that. So 56% of our households that we serve are senior households. And that'll be made up as I talk in the future because we have lodges and senior self-contained. A lot of our portfolio is made up of seniors type housing. 25% are households with children. And our community housing program, 76% of those households are with children. Next slide. The primary source of income. Fixed incomes is huge for people who require supports. Seniors, of course, the 56% are basically on pension, fixed income. 22% are on income support or AISH, which is Assured Income for Severely Handicapped. Only 9% of our households report employment as their primary source of income. So basically, it's those on a fixed income that can be struggling as rents go up faster than incomes do. Next slide. So our wait list, we looked at our wait list and to see where are the biggest needs. And currently the highest needs are those households with children at 47%. We have 31% are single parent households with children. And luckily only 20% of the wait list are senior households. So how do we run our programs? We run our programs under the legislative framework of the Alberta Housing Act. The Alberta Housing Act sets the rules and regulations of how our programs are to be operated. It also establishes the authority of the Alberta Social Housing Corporation, who is the body that owns the majority of the properties that these programs fall under. It also establishes the creation of housing management bodies. Kathy spoke of Silvera in Calgary, and Silvera is a housing management body that partners with us and administers a number of these programs. Calgary Housing Company is another one. They're not a management body, but they're one of our partners. If you're in Edmonton, you might know GEF Seniors Housing or Savita, who previously was known as Capital Region Housing. So we have about 88 housing management bodies all across the province, serving low-income families and seniors who need assistance. Next slide. Good. So let's get into the types of affordable housing that we operate. Senior self-contained. So we talked a little bit about that. We have about 14,300 units in various buildings all around the province, from a fourplex in Radway, in northern Alberta, to a over 200 unit facility in Calgary. So there's quite a range of options available. These are seniors apartments. Oh, go back, don't jump, Carol. These senior self-contained apartments are geared to low-income seniors, so those who have an income below that affordable, the hills. So if you remember what I said at Hills. So if their income is at Hills or below, then they would be eligible for the senior self-contained program. And the rent is set at 30% of their adjusted income. There are certain types of income that we take out, and then you pay 30% of your income for your rent. Okay, now we can move. Seniors Lodge. These ones, we have about over 10,000 units all across the province as well. And this Seniors Lodge was kind of the very first supportive living facilities in the province. They started back in the late 50s, and it was when there was a need. There was a high number of seniors in auxiliary hospitals who really just needed light supports. They didn't need to be in the hospital. So seniors lodges were built, again, all over the province in nice little small rural areas up to the big cities as well. In the seniors lodges, you get a room, which is your bedroom. And then your meals are provided, recreation is provided, housekeeping is provided, and you don't have to worry about, building maintenance or anything like that. The lodges, as far as the rates, this is eligible to any income level, but it is priority rated to lower income seniors first, because they have less options. But everyone who lives in a lodge must be left with a disposable income of $322 to use on other things. Okay. Family and community housing. These are our geared to family houses. And these could be apartments or townhouses, and the rent is set at 30% of their rent geared to income as well. And this is geared to low income with their income at or below hills again. Okay. Rent supplement. This is a little bit of our favorite program right now because it is such an easy program for the recipients as well as for us to operate. Currently, or the last numbers I saw, we were at 8,600 tenants receiving this, but that number is going up because last year we received an additional 16 million to add to this program, which is helping us put more and more people on the program. The rent supplement program provides a subsidy directly to the tenant in the RAB and the TRAB, which stands for Rent Assistance Benefit and Temporary Rent Assistance Benefit Program. So a tenant who is having a difficulty paying their rent gets a subsidy depending on, you know, the family size and their income of a certain amount that helps them pay that rent. So if they're currently paying, say, 50% of their income, this subsidy is going to bring that down to below 50%, you know, maybe 40, maybe 35, but it's going to give them a big help for the future. And so they aren't struggling with everything else. The Private Landlord Rent Supplement Program, PLRS, the benefit was paid to the landlords. This one is phasing out, but it is a big one that we had for a very long time. But in those cases, a tenant would have to move to a certain building under a certain landlord in order to get the benefit, which shows why we kind of like the new system now, where people don't have to move and go through that as before they get a benefit. Okay. And then we have special needs housing. Not as many units here. These ones are very targeted to like specialized populations. These would be people that maybe have disabilities. It might be more of like a group home. It might help survivors of family violence. These are more where it's geared to a special population, which is why we don't have as much. But in most of these cases, the rent is subsidized again for the 30% rent geared to income. And then the last one we have was our most recent, and this is called the Affordable Housing Capital Grants Program. The purpose of this program was to increase quantity of apartments. So we went through a time when this came out that vacancy rates were very low and rents were going up like crazy. And it was just basically a need and demand. So the government came with this program. It added a lot of additional inventory. And in order to get a grant from our ministry, you had to promise that your units, or at least a certain number of units, would be below the market rents, the average market rate. So we have a number of these apartments where rates can be a minimum of 10% below the average market rate, but it may also be 20, 25 or more below. These are not regulated, and we had 20-year agreements for them. So some of them will be starting to expire now, because that program was about almost 20 years ago when it started. But it's another way to assist by keeping rents lower and make more opportunities for lower income Albertans. So that takes it from me. So I'm going to pass it off now to Sylvia, who's going to talk about the Stronger Foundations, the strategy to improve and expand affordable housing.
All right, thank you, Barb. And conscious of time, I'll try to keep this quick. This strategy is available online. There's, for those of you who don't want to read, I think it's about a 10-page, 12-page document. There is a 4-page cheat sheet on there, so you could always go and look at the 4-page cheat sheet. For me, I always like simple and quick. And that's where you can see all the actions in the strategy. Here today, I'm going to just highlight a little bit of why we did the strategy, some of the key principles behind it and shifts behind it, and the key ones here for seniors housing specifically. But again, I won't go through every single action, but they're out there for you to see. And again, all of them will apply in a seniors context, but I'll focus on just a few key ones. So why did we need a strategy? We all know, like as Barb kind of walked through some of the stats, we know there's high demand. We don't have some of the same affordability problems like Vancouver or Toronto, where for affordability, as housing speculation really goes through the roof. Alberta is really not that bad yet anyways. But what we do know is that on the low at rent spectrum, for low incomes, we do have a huge gap in supply, and we do have a huge demand. So while overall housing affordability is not the worst in Alberta, it is, we are below the national average when it comes to affordable housing stock. And part of the strategy is to bring us up to that national average at a minimum. So we know we have, again, demand through our wait lists, as well as through some of the stats that we have out there. And also just what we're hearing through our groups of, again, about the kind of demand that we have out there. So I'll just keep moving on. This is also in response to several government platform commitments. Again, to build more affordable housing, especially for seniors who need specialized housing, repurposing capital funding for partnerships, making sure we get more value for taxpayer dollar, and expanding the use of mixed income. So again, making sure we have inclusive communities and more creative options out there. So how do we meet the demand? The government's challenge to us was really how can we meet that, given our fiscal environments and everything, how can we address that demand in creative ways? So the review panel, some of you hopefully participated in that work. The panel went out, a short time frame, about 6 months of work, to reach out, hear from stakeholders, dig into the issue and see what kind of issues we have. And they looked at the same stats, supply, demand, all kinds of factors. And they came up with 19 recommendations. The final panel report is also available online if you'd like to see that. Government did accept all of those 19 recommendations. And so recommendation number 1 was really to create a strategy, a government strategy that would give a clear indication to our stakeholders on what we intend to do. And so that's therefore the Stronger Foundation strategy was born, as saying, yep, here's our strategy, here's what we plan. And we do follow quite closely those 19 recommendations. If we go to the next slide, some of them you'll see are very similar. We made sure we address each one of them. Maybe we can skip this one for the purposes of time, because it does skip it all. So based on the panel recommendations, there's a few key shifts that were identified for us to move towards a more sustainable approach towards affordable housing, making sure we address that gap. And some of the key ones were making sure government shifts from being an owner to a regulator and a funder. So really, as Barb mentioned, the Alberta Social Housing Corporation owns not everything, but a large amount of the stock right now that is called affordable and social housing. And so shifting away from that, and that's for a variety of reasons. We can't borrow against our properties. We can't leverage that property to build more. If you look at how just the housing market works in sectors, right, you're allowed to do that, but we are sort of limited and constrained by certain rules and regulations and authorities that, again, would not happen if we were not the owner of it. Similar things occurred in Ontario and BC, where they also, again, to tap into those assets and be able to maintain them better and leverage them better, they shifted in the ownership approach. So shifting more also from a supply side. So we will always need supply, not saying that we won't do supply. That could be redevelopment or building, all kinds of things. But we do have to shift more towards a demand side focus. And when we say that, that means more about supporting the tenant, again, with things like rent supplements. Again, we do have some gaps in Alberta when it comes to supply, but as I've kind of talked about, not nearly as bad as in some other jurisdictions or other cities or communities. So it also is very community dependent. I want to say that as well. So while I say that overall as a general thing for Alberta, one community may be having a huge supply gap where building is the right solution, and in another community they've got high vacancies, and so having units available is not the issue. It's, again, affordability that becomes the issue. So you do have to look community by community for sure. And that's one of the key shifts as well, is making sure we are flexible enough to tailor our solutions to local community needs. So one of the things we're looking at is how do we pull back some of that regulation to ensure that there's flexibility, partly in terms of how do we address tenants themselves, like an individual's situation, but the community situation in particular. So what is that solution that's going to actually address the challenge that is in the area? So making sure we have those flexible rules. Moving more towards mixed income is an approach that we've seen in a lot of jurisdictions. Again, not only because of community integration, the tenants have better outcomes when they're not sort of isolated ghettos of social housing. That's a fairly old model that every jurisdiction has been moving away from. So it's not only about tenant outcomes, but again, about sustainability. Concentrating deep subsidy means we aren't able to generate revenue or find ways to make these operations more sustainable. And so how do we introduce a mix, not only for the health of communities, but for the sustainability of how we operate? Treating income more equitably is another area which we're exploring. It's one of the things that the panel really dug into, because right now we have a lot of different kinds of exemptions and treatments of income. And so if you make $1,000 a month from one source of income versus $1,000 from another, you might not be paying the same rent. And so you could be paying anywhere from 18% to 45% of your income. And as we kind of talked about, 30% of income is our standard that we're aiming for, but it could be anywhere from 80 to 45, depending on what is your source of income. So how do we make that more fair and actually treat affordability in a more equitable manner? And more planning and coordination and strengthening the role of, again, our communities in assessing what we need are key things. So we can move on. Again, there's lots in the, if you look at the all the actions in our strategy, they'll give you a good indication of how we see those shifts playing out. So the vision, obviously access to safe, affordable housing that meets the need and promotes quality of life. We want a housing system that delivers innovative and sustainable housing options through partnerships with orders of government, nonprofits, and private housing providers, as well as communities, and a housing system that serves Albertans now and into the future. So that's just bringing into that sustainability piece that we're looking for. The principles, again, they align very much with the panel principles: shared responsibility partnerships, focus on people, adjust to meet their needs, fair, equitable, and inclusive. Making sure we protect vulnerable Albertans is one of our key priorities when it comes to social and affordable housing. Fiscal stewardship, and flexible and adaptable to local needs, as I've talked about already. Targets. So I talked about us trying to get to that standard of national average. So right now we are below the national average in terms of housing stock for affordable housing stock. To get to that national average, we would need an increase of 25,000 households. That's how we came up with that target. Does that mean that won't shift over time, that will still fall below the national average 10 years from now? It is a 10-year strategy, perhaps. But again, this is a place to start, and that would be a much bigger increase in 10 years than we've had in the past 10 years or the decade before that. So it is a substantial growth in households served. Of course, our goal is to reduce the number of people in core housing need, especially those in deep core housing need. We will never be able to reduce the wait list. There will always be a wait list. Demand will outstrip supply, even if we increase the supply or the availability of supports by this amount. But we are looking to reduce that wait list by 30%. So for those who are waiting and for those who are in need, making sure we do get through that wait list and address it better. Increasing accessible and adaptable units, we've heard about that a lot. We do have targets whenever we do a capital project, but again, with an aging population, we want to make sure there's enough and that we're addressing those needs. Increasing the below average market housing as well as sort of that more moderate need. And about half of that increase we're looking at achieving through rent supplements. So again, flexibility and choice, utilizing existing stock where it exists. Where there's vacancies, that is a good strategy. It's also a good way to quickly address people's affordability. As a long-term solution, though, it can't be the only thing we do. Over the long term, rent supplements can balloon and be very expensive, especially as market rates go up. Your rent supplements go up. I mean, as we have seen over the last couple of decades, rents have been increasing at a much higher rate than inflation, overall inflation. So that cost of housing is going up in proportion to other costs. Moving on, our goals. I won't dwell too much on this slide, but of course, for the household, we're looking for stability and safety, social inclusion, improved quality of life, making sure that their people are empowered and making community connections. For the community, it is neighborhood revitalization, the safety of that community, job creation, and market gaps. For owners and operators, it's making sure that they have more autonomy and ability to maintain and leverage those assets in a responsible manner, gives them a bit more freedom on how to do that, able to innovate, to identify innovative revenue options, and being responsive to local needs. And the GOA, of course, we want to reduce core housing need, system alignment across the sector. So that includes health and community and social services and those other ministries we've been talking about, and financial sustainability over the long term. The key actions. So there's There's several actions under each of these themes, but again, these are the key areas where we are focusing on. So with supporting Albertans most in need, it is that focusing on the most vulnerable and making sure eligibility is fair and clear and equitable. Improving access is making sure that it's simpler to get to affordable housing or social housing, that it's easier for those providers to deliver supports, and seeing how we can enhance that coordinated supports, as we've been talking about. Increasing capacity planning and governance. We're looking to create more longer term plans. We tend to go budget by budget, year by year, proposal by proposal, creating longer term plans for government on where and how we're going to build or redevelop or whatever may be the case. A huge part of this is local needs assessments, becoming an input into that planning process. In terms of capacity, some of you may have heard of Bill 78 that passed in the fall. One of the things that was passed there is that we're looking for competency-based housing management body boards. It's just a shift, a good practice for all boards to be competency-based. But in particular, if we're looking to shift ownership to an operator, making sure that there's that capacity to be an owner as well as an operator of that housing. Enhancing sustainability and efficiency. So looking at, again, this is innovative models, mixed income models, things like that. And enabling growth and investment. So that's, again, making sure we are investing either through rent supplements as well as through capital programs to make sure that we've got the growth that we need to keep up with demand. So all of these actions really are still relevant for seniors housing, and I do encourage you to look at all of them. But there's three in particular that speak specifically to seniors housing. One is 1.7, so to increase seniors housing in line with population growth. This is, again, as we've seen through the stats at the very beginning, a big issue. We want to make sure with the growth in seniors population will be a growth in low income seniors population as well. And as you can see, costs are going up. So are we going to see a higher proportion of low income seniors? Hopefully not, but again, one of those risks that we have to be able to address. And so at a minimum, keeping in line with population growth. As Barb mentioned, about half of our stock already is seniors oriented housing. And we do know there's a huge gap in demand, growing demand on the community housing side. So how do we balance that? We're going to try to balance that by at least keeping seniors housing in line with the seniors population growth. Collaborate with the other ministries. So we have a continuum of supports. So you may have heard about the continuing care review. I'm assuming they'll be coming here, maybe at a future session. Where again, how do we collaborate when it comes to that continuum of care? And again, seniors moving to higher level of care and to different levels of independence. Those are key things as they move in and out of our housing, and making sure those transitions are smooth. And then action 5.6, there at the panel and a lot of folks identified a huge opportunity for lodges in rural areas becoming hubs. So we are seeing, depending on where vacancies in lodges, that happens for a variety of reasons, demographic reasons. COVID was a huge reason for people perhaps shifting out of congregate living in the last couple of years. And so when it comes to lodges in rural areas, we have a lodge partnership program to make sure that DSL spaces are available in those areas. And again, seniors aren't moving out of their communities to access those higher levels of care. They could become home care hubs, all kinds of ideas about how we could better leverage lodges in rural communities, expanding some of the things we're already doing and some of the innovations that we've seen out there. So those are the key actions, and apologies for maybe taking a bit longer, but I think back to Shawn.
That's great. Thanks, Sylvia and Bob. Thank you very much for your presentation. I think it's time to move on to the question and answer portion of today's sessions. Carol's been monitoring the chat, and I have some of the questions that people have already shared, and I can read those out. But also, please feel free to raise your hand, unmute, and ask your question directly. So we'll be keeping an eye out for anyone raising their hands. And I will just start with the questions that we've already received in the chat. So Kathy, I think this is just a very simple request. Can you share your contact details? I think some people are interested in
Sure.
potentially connecting with you.
Absolutely.
And excellent, thank you. Sorry, let's see. And then The question was, why is Elder House having troubles taking off?
So they received some funding. So the city of Calgary gave them some land, which really worked out. And then they also received, I believe, some funding from the province. And then I think the expectation was is that they would raise so much money on their own to get across the finish line. And just for a variety of reasons, COVID and all this type of thing has really impacted them. But I think they only need about $2 more million, 1.5, and they could go forward. So it's such a shame because they actually have the drawings and are happy to also share that model once they get going so that it could be replicated in a variety of other settings. So if you know any friends that have 1.5 laying around, please give them a call.
Excellent, thanks, Kathy. And then I think we have another question here. So do you have any examples of income diver models or income driver models of housing in Alberta? I think that's to Barbara. So. Bob, is that
Can you repeat the question?
Or?
Can you repeat
sure.
the question?
Do you have any examples of income divers models of housing in Alberta? I'm wondering if it's income drivers models of housing in Alberta. It's from Karen.
In the chat, it says equity diversity models. So what we are currently working with is we're working with a consultant who is helping us draft a mixed model program. They're collecting data from a number of properties that are using a mixed model project now, and they're going to help us draft what we should be doing going forward. So that program is under development, and we hope to be in the fall once everything's wrapped up and we can kind of create something that will have more information on that coming out. Did you have anything more to add, Sylvia?
No, that's perfect.
Okay, great. And then I think this one is for you, Kathy. The person says, I'm wondering if you could speak to what additional barriers exist for older adults who are experiencing homelessness. Is this a population that Calgary Seniors Housing Forum speaks to or works with?
No, we really don't, unfortunately. We just haven't had a lot of interaction with individuals who are, well, there's different types of homelessness, isn't there? So there's people who might be living rough. That's a group that generally needs emergency housing, and there's lots of agencies that help them currently and are aware of that population. Then we have the couch surfers, or people who are staying with friends. And yes, we actually do work with that group. And through our housing forums and meeting people in person, we counsel them on how they might access housing through different groups. So Kirby Center being one, and a variety of other supports.
Okay. Thanks, Kathy. Sheila O'Brien, I see you have your hand up, so feel free to unmute and ask your question.
Hi, I'm wondering if there's anyone on the panel that has any experience in working in the very rural areas of your province with the small towns and hamlets that have infrastructure problems that almost create a barrier to congregate housing and small individual housing groupings.
We do partner, like I was saying before, with a number of management bodies all over the province, right? We've got them right from High Level to Swan Hills and High Prairie and Raymond and Pincher Creek, Crow's Nest Pass, they're all over. And what we're going to be doing is working with them a little bit more. We want to grow their capacity. We want them to be able to, work with the communities as far as when it comes to I know needs assessments is something that we're working on with the municipalities as well, to kind of identify where are the needs and what can be done and what types of housing can be done. So we're relying on our partners out there, the operators who are in those rural communities, to find out what is needed and how can they do that.
Mhm. Here in Ontario, we're facing issues with technology, in the sense that some of our small towns and hamlets are not on water and sewers. So if you want to build a fourplex or that very nice townhome community that's a block by a block, you know, that they have in Calgary, all of a sudden there are environmental regulations that you can't have that many septic tanks. Here in Ontario, the province is not supporting holding tanks anymore. I'm just finding we're coming up against those kind of brick walls that are forcing our seniors away from their communities. Have you encountered that in the small towns in Alberta?
For sure, I don't know if it's so much infrastructure, maybe someone knows better than that, but one thing we hear a lot of is other kinds of services. So medical services, social supports, all those kinds. And that spans both seniors and non-seniors. About often smaller communities just won't have the same resources available to support a family in need. And so you end up seeing some migration, of course, to the cities where they can find those supports, or to larger centers. And so that also then presents a challenge for planning. And we don't have a solution, but it is something we grapple with when it comes to where do you invest in housing and where do you support? Do you build where the services already exist, right? Where and how do you decide which community gets that housing support? The demand is higher than we have the ability for, right? And so you have to make a choice. And you know, if you can show that there's transportation, there's medical options, that there's available in that community, you know, makes it a much easier to say, yeah, you're checking all the location points that really make this a good place and a viable place for that that group to live in, right? So it's a challenge for sure. We don't have a silver bullet, but again, that's where, as we move forward with the strategy, we want to be able to better plan, articulate where and how we make those kind of choices, but for sure they're not easy.
Thank you very much. I appreciate your input.
Okay, thanks, Sheila. And then we have a couple more questions from the chat. It's potentially our last two questions. So I'll read out both of them. So how much contact, collaboration and cooperation is there between provincial ministries and with the federal seniors ministry? And then the second question is, would co-op housing options, so to develop affordable housing for seniors themselves, with units being owner occupied, be able to access funding through the GOA's affordable housing program? I think those are both to you, Barb.
Well, I'm happy to answer the second. So that right now there is no affordable housing program that we're running with. There's very, very limited cases where if we have existing housing that has worked up north, where say we have single family homes and we offer a purchase program, like you can buy this as an option, but we currently don't have any home ownership programs in Alberta right now. We do support things like Barb was mentioning, Habitat for Humanity and home ownership programs that way, but it's through Habitat for Humanity. There's no other sort of capital or other kind of program right now associated with that. The federal government is interested in things like that, but right now Alberta's not there right now. In terms of the first question, maybe someone like Carol or someone else can answer, because we don't really interact with the Ministry of Seniors at the federal level. On the housing side, we interact with Minister Hussein. I forget his the title of his portfolio changed. So the Federal Minister of Housing and I think Diversity or something like that. Anyways, we do work with them. We have a bilateral agreement with the federal government under the National Housing Strategy. That's through which most of our programs flow. And as well as the rent supplement program, for example, is co-funded between the federal government, the Canada Housing Benefit, and Alberta. So that is our main interaction point with the federal government on the housing side. But when it comes to the Minister of Seniors, I know seniors does a lot of work on that side. So it's just something I'm not involved with. So maybe Carol or someone else can better answer that.
Carol, did you want to add anything?
No, I don't think so. Because you're just, sorry, the question was the collaboration between
Provincial ministries and the federal seniors ministry.
And the federal seniors ministry. And I think we are connected with the minister responsible for seniors, and our area and the Ministry of Seniors and Housing participates on the federal provincial territorial ministers responsible for seniors forum, and we're connected that way as well. So we do keep connections, but specific to housing, because I guess that would fall more in your division as opposed to our division, although there are a number of different connecting points, and there's a lot of overlap between housing and community supports and other things. So we do have contact and connection with them. I guess it just depends on what you're asking for with what type of contact and collaboration we have, but we definitely try and keep the doors of communication open.
Okay. Thank you very much, Carol. I think that is the last question we had, and so I think we'll we want to make sure that everybody's aware of the next sessions coming up. So thank you very much to all of our speakers and to everybody who attended. It's been a really great session, so that to get this housing series, or age-friendly housing series, off the ground. So thank you ever so much to Kathy, Bob and Sylvia. That's been wonderful. And I wanted to let you know about the upcoming session. So I know there was a question, for example, around homelessness. So there is a March 23rd session that's going to be on later life homelessness and affordable housing for seniors. We've got one on the April 27th on the characteristics of age-friendly housing for seniors, and that won't be looking more at the kind of different built forms and considerations specifically. And then we've dedicated a whole session to innovative age-friendly housing models that you would have heard Kathy talk about quite a bit. And then we finally have a supportive housing and continuing care session on June 22nd. So you can keep abreast of those sessions by keeping an eye on Core Alberta or signing up to the newsletter. And I would just remind you about those groups, the 2 age-friendly groups, if you're interested in doing that. So thank you very much, everyone. Carol, is there anything that you wanted to add before we wrap up?
No, I think that I just want to say great job. I think we got all the questions in the chat and all the hands raised, and fantastic job on behalf of yourself as the moderator and our presenters. And I look forward to seeing many more of you on our upcoming sessions.
Excellent. Thank you, everyone. Have a wonderful day.
Okay. Have a great day. Shawn, if you just want to stay on, and Barb and Sylvia and Kathy.